We're going to bring in our own chief health editor, Dr. Partha Nandi, to continue this team coverage. And Doc, getting kids vaccinated going to be crucial. We hear Rutgers University is requiring students to be vaccinated this fall. Others may follow suit. Why do you think colleges are considering making vaccinations a requirement, especially with the age group not considered high risk?
So a number of reasons, right? It would certainly make the classroom a safer environment. I can understand that, where students could focus on learning rather than worried about getting infected. Another reason could be because younger adults are driving up case numbers for COVID-19. So a vaccinated population means less spread, fewer sick people, students and faculty together. And you're right? Younger folks are considered to be less likely, right, to get seriously sick. But it does happen, right? And they can end up hospitalized. They can, some even have passed away from it. And while the death rates in younger patients, younger folks is low, don't forget that they can end up feeling unwell for months. I've had a number of patients that have had this long-term symptoms even after they had COVID several months ago. And they have to deal with long-term symptoms, trouble concentrating, body aches, shortness of breath. Any of these can have a really negative effect on the quality of a person's life.
So we talked about this, Doc, a couple months ago about the workplace, but can colleges legally require students to get this vaccine?
So Glenn, it's not uncommon, right, for colleges to require vaccinations. For instance, there are colleges that require students to be vaccinated for diseases like hepatitis B, meningitis, measles, mumps, rubella. But even if colleges do mandate that the students have to be vaccinated for COVID-19, there'll be exceptions, right, for religious, medical reasons. Also, any student who's not attending class in person and are studying remotely will not need to be immunized for the virus.
Well, we know about the vaccine hesitancy among young adults. So what can you tell us about this?
This always concerns me. So here's the research. The Pew Research Center did a recent study led in early March. And yes, they did find that younger people were less inclined to get vaccinated for COVID-19 when compared to folks who are 65 and older. It's not really surprising, right? Because older folks are the ones who are higher risk for severe disease, so young folks may think it's not as important for them. Now, just because there's a hesitancy doesn't mean that younger adults are against vaccination. It's kind of a subtle difference. There was another survey, right, done by a research company named College Pulse, and they surveyed 1,000 undergraduate students. And what they found was 71% agreed that colleges do in fact have the right to require student vaccinations for COVID. So the way I look at it is if a young person can avoid an illness and avoid passing it to others who could get seriously ill, that's huge. And they could even prevent somebody from dying. And I'll tell you that it can help us to reach herd immunity. It can help protect more vulnerable people. And it can stop the virus from replicating. So remember, the less the virus replicates, the less likely we'll see new and possibly more dangerous variants. To me, COVID-19 is a legacy also for young people. Do you care enough about the people that are around you? Do you care about the people that are more vulnerable to do the right thing? It's the legacy that they will leave for the population around us. To me, I think they'll meet the challenge and do the right thing.
Yeah, youth not being a cure is certainly an important point to make. Dr. Nandi, thank you so much.